Traditionally, the role of a radiographer has been in simulating the patient and delivering the radiotherapy rather than getting involved in the planning of treatment.
Being the first consultant radiographer locally in this trust, people were curious as to what the role would actually mean and what it would add to the service. The idea is that the scope of practice of my role would lend itself to working in a complementary fashion with the oncologists.
We're not trying to pretend that Neil is a full medic. He isn't. He's taking on some of the duties within a confined scope of practice, but it just shows that it's doable to replace that traditional model with a new model.
My role is essentially a specialist role dedicated to breast radiotherapy, to bring patients in from a referral from MDT into the radiotherapy pathway and manage their care throughout that pathway right up to discharge.
We felt that radiotherapy was ideally suited to having a consultant role because our skill set has expanded over the years, meaning that we were able to fulfil all the core domains of a consultant AHP practitioner.
The Department of Health remit for a consultant AHP member of staff is that you would have 4 core domains of a role, one of those being expert practice, but others dedicated to areas of research and education and service leadership. So I'm fortunate that my role entails a link with our higher education institution.
He's actually part funded by the university for 1 day a week, and that's a really good model for this role, I think, to ensure that the 4 pillars of consultant practice are being supported.
When we developed the post, we looked at where the gap in the service was, and the training that then Neil had was to fill that gap.
We piggybacked with the FRCR, which is the Royal College of Radiologists training, that we would do the same training that a clinical oncologist would do for a subsection of the breast oncology module. How patients are referred in for Neil as a consultant radiographer and for a clinical oncologist is no different.
The key thing here is making sure that our scope of practice is covered in terms of my competencies to assess patients. So for example, I've undertaken patient assessment and consultation skills training. I can adequately take a history of a patient and assess them. I can also look at advanced methods of communication for these patients who are understandably undergoing quite a traumatic period in their lives.
That's probably because it's just the competence.
In terms of ongoing support for Neil and in terms of the governance of Neil's role, he does have additional clinical support from the breast team, and he has a nominated breast lead in Dr. Shri Kumar.
Originally, when we started, many of us understandably were apprehensive as to how this job would develop. But I think Neil has been a big asset to the department, mainly because Neil comes from a background of a radiographer, which most of us clinicians don't often do, and also now he can see the clinical side of things, so he is in a very good position to bring the two together.
The advent of advanced clinical practice for AHPs, and certainly my role as consultant radiographer, has opened up enormous opportunity.
We are able to demonstrate that therapeutic radiographers can prescribe and deliver radiotherapy and take on some of the more traditional clinician roles and do it successfully.
I've no doubt and I've no problem saying that Neil has made a huge big difference to our practice. We work as a team, just like I would with any other doctor colleague of mine.
It is a real pleasure to see that we now have a clinical role that gives career progression for people who do not want to lose their clinical skills.
At the moment, I'm relatively early in my consultant radiographer life, and I can see the opportunities going forward to develop both in terms of my clinical skills, but also in terms of my academic and research skills. The impact we've measured across all 4 pillars of this domain, I think, is really significant, and I'm glad that AHPs have the opportunity to add this to the service.